I'm Emily Walker of MedPage Today in Washington, D.C. at the ICAAC-IDSA joint meeting. I'm here with Dr. Dennis Stevens, an infectious disease physician at the VA in Boise, Idaho. He presented results of a new study that found a new drug called iclaprim was effective in curing skin infections caused by MRSA. Dr. Stevens, can you please explain your study a little bit? What was the study and what did you find?
Well, this was a phase 3 clinical trial. It was multi-center, double-blind comparative trial to look at the efficacy of iclaprim compared to linezolid for complicated skin and soft tissue infections. And so it was a study that involved patients in Eastern Europe as well as the United States. There were approximately 500 patients that were enrolled in each arm of the study.
And what were they administered and what did you find?
Well, they were administered either iclaprim or linezolid intravenously every 12 hours. And the primary endpoint was so-called test of cure, which is usually 10 to 14 days after the initiation of the antibiotics. And in that sense, for patients that met the inclusion criteria for skin and soft tissue infections, the response rates were equivalent between linezolid and iclaprim.
Could you explain a little why you chose to use linezolid and compare linezolid with iclaprim rather than another antibiotic?
Well, at the point in time the study was being designed by ARPITA, there was a clinical trial that was just being published in its preliminary form that had looked at linezolid versus vancomycin for complicated skin and soft tissue infections with essentially exactly the same inclusion criteria as the study we're talking about today. And those results were presented by Dr. John Weigelt at the Medical College of Wisconsin. And those studies indicated that linezolid was superior to vancomycin. So I felt like in developing a new compound and initiating clinical trials that the best comparator would be the antibiotic that was the gold standard, that had the best efficacy. I was concerned about human subjects' enrollment and ethical issues to use a compound that was not the best. So that's the reason that linezolid was chosen as the comparator.
Could you talk a little bit about the connection between MRSA and the group A streptococci and skin infections? How common do people with these infections or these bacterial infections get skin infections?
Well, that's an excellent question. When you look at skin and soft tissue infections, it involves things like furuncles, abscesses, cellulitis, and the most common organisms that cause those kinds of infection are group A strep and Staphylococcus. And as you know, over the last 3 or 4 years, there's been a virtual explosion of methicillin-resistant staph infections in communities throughout the United States, and now it's being seen in Europe as well. So group A strep and staph aureus are clearly the most common bacteria that cause skin and soft tissue infections.
Okay, and where does the drug stand right now?
Well, the clinical trials with iclaprim have been completed. The database has been closed, and there's been petition to the Food and Drug Administration for approval. And as I understand it, the company will present their results to them in November of this year.
And are you optimistic that the drug will be approved?
Yes. Yes, I definitely think it will be approved. It showed good efficacy, and there were really no major safety issues. So the drug appears to be well tolerated, and there's a need for new compounds to treat skin and soft tissue infections, primarily because of the explosion of the methicillin-resistant staph, and because several new compounds have been developed, but resistance to some of those agents has already begun. So I think bacteria are smart, and hopefully man will keep a little bit ahead of the organism in being able to come up with antibiotics that obviate their mechanisms of resistance.
That was Dr. Dennis Stevens. I'm Emily Walker, MedPage Today.